A 4-year-old boy present to the emergency department with 2-day history of the fever, difficulty walking, and unable to weight bear on the right leg. He has been on oral amoxicillin 250 mg 3 times a day for a chest infection over the last 5 days. He is irritable with a temperature of 39.4 degrees Celsius. He does not allow examination and keep his hip flexed and erected. Blood test shows WCC 18.3, which is very high, CRP very high. So WBC high, CRP high, that means there is a definitive infection. Hemoglobin 11.3 gram per dl. And here we can see there is the fever, that means when the temperature increase there is difficulty walking. These are the features of acute inflammation. So acute inflammation caused by infection in this case. So what may be the answer? Here the options are acute vascular necrosis of the hip, dislocation of the hip, Pathis disease, septic arthritis, and slipped upper femoral epiphysis. Now see the factor favoring the septic arthritis. So what are the factor which denotes it is septic arthritis? First of all, the WBC or WCC more than 12, ESR more than 40, inability to weight bear, and temperature is more than 38.5. So these all features are present in this case. That means it is going in favor of the septic arthritis. Now see the septic arthritis. The septic arthritis, it is usually caused by Staphylococcus aureus. And it usually occurs in case of the school going children. Urgent washout sometimes required, but first line treatment is the antibiotic. What is the diagnosis? Diagnosis is the plain X-ray, sometimes aspiration, and utilize the Kocher criteria. Now see the Kocher criteria. So what is the Kocher criteria? First of all, non-weight bearing of the affected site. That means when there is the septic arthritis in this area, usually patient unable to bearing the weight. ESR is more than 40, fever, WCC is more than 12,000. When 4x4 criteria are met, there is 99% chance of this child is the septic arthritis. And in this patient, we can see there is non-weight bearing, it present in this child. ESR more than 40 also present, fever present, and WCC about 18,000. So it is also true. That means the 4 Kocher criteria present. So it is in favor of the septic arthritis. And what is the treatment? Surgical drainage is required of the affected joint, and it is done as soon as possible to prevent the permanent damage of the joint. The repeated procedure are sometimes necessary. Appropriate intravenous antibiotic should be administered. So the joint drain required and appropriate antibiotic requirement. So what is our diagnosis? Our diagnosis is the septic arthritis. Why septic arthritis? Because first of all, see there is the fever, difficulty walking. That means the affected joint is unable to bear weight of the affected joint. And here also we can see the blood tests. WBC count is high, which is the 18.3, CRP very high, which is the 146. So it is in favor of the septic arthritis. Also temperature is 39.4, which is very high. So it is the septic arthritis.